Most important thing here is increasing awareness, because most of the reason the miscommunication happens is because the pediatrician, mostly it's obstetrician who deals with it initially. Sometimes the parents come to the pediatrician for second opinion. So the obstetricians who are doing these fetal scans or requesting these fetal scans uh, do not have the full picture in mind. So this education that this session that we are recording should reach more people. So I request everyone to share this, and so that this information reaches, and there are many reliable sources to educate yourself from as well. So the fetal medicine centers usually are aware of this, but the fetal medicine center doesn't counsel the family because they act as a third party. They are doing the scan and giving the report to the obstetrician. It's the obstetrician who is looking after the mother who actually ends up counseling them. And if the obstetrician doesn't have enough knowledge, either they should ask the fetal medicine center or have a system in place where the fetal medicine center counsels at least the abnormal results. So many times it may just need clear counseling to the family that a soft marker is not anything dangerous. It just needs additional input and monitoring. And then we should be also careful to quickly emphasize to the family when the report is normal so that they don't carry the anxiety and the stress throughout the pregnancy, and it may spread to the wider family as well. So it's very important that this clear education system is in place, a clear network of communicating between professionals and clear communication with the family as a part of a multidisciplinary team. So if a parent has anxiety, they should be cleared immediately by experts. So the knowledge, spreading of knowledge, being clearly educated on the impact of these things and communicating with the family. In UK, for example, the midwives are all trained in this. They take the consent and they discuss, but in India or Egypt, I don't think that's happening. So that's an option that if the physicians themselves are busy, they have people who are educated and can counsel the family in the system. So there should not be a misconception that keeps aggravating the maternal stress in the pregnancy. And we should not do unnecessary tests which are invasive or even terminate a pregnancy, which is a very difficult thing for the family on the basis of some flimsy signs. So they should be very clear that what they are doing is appropriate. So this message should reach everyone. It's a very important message.
Yes, it's a great. So, Dr. Sridhar, by mentioning soft markers, can soft markers have any impact on the health of mother or fetus?
Usually, there is no impact on the health of the mother apart from the anxiety generated. So, when you're mentioning it and we're talking of the brain, heart, gut, and everything, my parents start getting worried. They keep thinking about it, even if you reassure them. So, there may be maternal anxiety. That's why the counseling has to be done appropriately. On the baby, there is usually, even if it's a choroid plexus cyst or a mild ventriculomegaly, it doesn't affect the brain function. If it is echogenic gut, but the baby passes stool after birth and is normal, there is no need to worry about that. A mild pelviectasis on the kidney, again, if you monitor the scan and it is stable, it does need a postnatal follow-up scan, but it doesn't need any intervention if there is no hydronephrosis. If there is hydronephrosis, you would refer to a urology center. But apart from that, you don't need to be worried about any of these. The heart marker, if there is a fetal echo done, you don't need to consider doing a repeat echo after the baby is born, the echogenic intracardiac focus as well. Single umbilical artery, the baby's size may be slightly small, but if baby comes normal, you don't need to worry about that.
Great. So, Dr. Sridhar, about future directions, what new trends and innovations are emerging in antenatal screening for soft markers? And are there any maybe promising techniques related to earlier screening that may match with religious concepts, as you mentioned previously?
I mean, there are exciting developments because artificial intelligence is a code nowadays. I mean, keyword, buzzword. So artificial intelligence can be educated to pick up all these soft markers, look at all the risks, and the information that is need to be given to the family can be generated by AI, and the parents can read through it. Of course, the physician may need to check through it, but once it is done a few times, you know it's reliable. You can blindly give it to them because software is there. You have the input, and then the output is going to be similar. So in the beginning, you may need to put more stringent monitoring for what output comes from the AI, but that will remove most of the problems with time constraints. So the parents get the exact, and translation becomes very easy with the AI as well. So they could get it in the parents' own language. So it becomes easier as well. Again, you need to double check if the medical terms are translated properly and jargon free. So you may have generated reports. So we are talking of chat BT or some chat GPT or similar. software, which can be educated to do this kind of work. And also the risk profiling may be easier. So even if the doctor is not fully aware, by going through this AI-based protocol, they will be clear. So this is the future direction. But the education part should be included in all pediatrician and obstetrician training in the medical school, and all doctors in general should have an idea, all midwives or nurses should have an idea of this. Anyone dealing with pregnant women should be clear about the impact of these so they can counsel appropriately in a timely fashion. So that's it about this aspect.